So before any athlete is tested, we first understand the full story. Step 1 of our OSSO Sports Plus assessment is understanding the athlete. At this stage, we look at previous injuries, current pain or limitation, training load, their recovery patterns and performance goals. This is important because all these factors play a huge role in deciding the right rehab plan for that athlete. Mobility looks simple, but for athletes, even small restrictions can change everything. Step 2 is checking mobility and range of motion. At this stage, we assess overall range of motion in different joints, any side-to-side differences, and more importantly, any movement restrictions. And wherever there are restrictions, we use a device like inclinometer for a more precise range of motion reading. This matters because reduced mobility can affect sprinting, kicking, landing, and any change of direction. And when one area does not move well, the body often compensates somewhere else. An athlete can feel fine and still have a strength deficit. We use a dynamometer to test strength more objectively as we assess absolute strength, again, any side-to-side differences, and more importantly, any muscular imbalances. This is especially important in an athlete because training at a certain level can hide imbalances for a long time. And if these are missed, they can affect performance and increase the chances of injury. Good movement has to be tested, not assumed. At this stage, we grade different functional movements such as deep squat, inline lunge, active straight leg raise, trunk stability, rotatory stability, and shoulder mobility. So while checking this, we assess control, coordination, stability, and the movement quality of the athlete. This helps us to identify movement compensations that may not show up in the previously tested isolated strength testing and range of motion testing. In sport, control matters just as much as strength. Step 5 is assessing agility, balance, and control. At this stage, we look at dynamic balance, single leg control, landing quality, and agility. This is important because many sports injuries happen during deacceleration, any sudden direction change, landing, and single leg loading. So now we move to posture and plantar pressure. How an athlete stands and how an athlete loads the ground both matter. In our AI-powered posture assessment, we look at overall alignment, asymmetry, how body segments are positioned, and in our plantar pressure assessment, we look at weight distribution, loading patterns, and pressure across the feet. If there are any pre-existing ankle or foot conditions such as flat feet, this gives us a quantified data to plan the rehab program. Together, they add another objective layer to an athlete's assessment. So now at this point, we bring everything together. Assessment matters only when it is leading to a clear plan. The final step of OSSO Sports Plus assessment is putting everything together. We combine history, mobility, strength, movement quality, agility and balance, posture, and plantar loading. This helps us understand the athlete as a whole. Based on that, we define the path ahead, which may include mobility work, strength correction, movement retraining, sport-specific rehab, load management, and obviously injury prevention. That is how OSSO Sports Plus helps translate findings into a focused athlete-specific care.